The U.S. spends significantly more on healthcare per person as a percentage of its GDP than other high-income nations, yet we continue to get sicker. About 129 million Americans are living with at least one chronic disease, which now drives close to 90% of all healthcare spending, or about 20% of our entire GDP. Healthcare costs are on track to grow from roughly $5.3 trillion today to more than $8 trillion by 2033. While life expectancy declines and nearly half of U.S. adults are worried they won't be able to afford necessary healthcare in 2026. And yet, we've kept nutrition siloed from healthcare solutions. At S2G, we believe food is one of the most powerful tools we have, not just for wellness, but for prevention, treatment, and long-term health. Our healthcare system was built to manage disease, but food has the potential to help turn it into a system that actually builds health. That's why we published a new white paper, The Food is Health Opportunity. It lays out how this sector is evolving, the 7 core market segments we see emerging, and what it will take to integrate food into healthcare at scale. To expand on the paper, we kick off this episode with a conversation between S2G's Sanjeev Krishnan and Dan Ritma to unpack why nutrition is facing an identity crisis, what happens when healthcare collides with the bond market, why food as health needs to be treated as strategic infrastructure, and where we really are on the path toward an integrated food and healthcare system. Then I speak with Sanjeev to understand what this means for investors, how food as health fits into the 5 structural forces shaping today's markets, how capital markets are viewing this space, and where real opportunities are emerging as food and healthcare finally start to converge. This isn't about improving food or improving healthcare. It's about redesigning and synthesizing 2 massive systems before their social and economic costs force the redesign for us. The episode drops on Thursday, wherever you get your podcasts.